Diabetes educators engage, empower, and support people with diabetes, at risk for diabetes, and with related cardiometabolic conditions. We provide diabetes self-management education, lifestyle behavior change, and integrate it with the clinical management plan. We do so in a person-centered care format, engaging the person with diabetes in all the decisions that affect them. We assess for resources, barriers to self-care, and then communicate and translate that into the knowledge and behaviors that they need to accomplish their goals, and link that to the clinical management team and integrate it with clinical management. The AADE, the American Association of Diabetes Educators, we have embarked on a multiple-year strategic plan to reduce the silos in healthcare for people with diabetes and to provide a holistic approach to diabetes self-management education and clinical management. We've identified key strategies to accomplish this. The first is the integration of self-management, behavior change with the clinical plan and integrating that into the care plan, including cardiometabolic conditions. Diabetes does not stand alone. Cardiometabolic conditions are blood pressure, cholesterol, obesity, and cardiovascular disease. Treating the whole person with cardiometabolic conditions is a key strategy for us. Providing support for technology. Technology is huge. Technology is the Uberization of healthcare, we like to say. It is overwhelming. It is coming at us quickly and is constantly changing. Our role as diabetes educators and our strategy is to support the people who want to use technology, to give them the knowledge and skills to do it to the best, to get the outcomes that they want, and then to take that data and the information that comes from it and incorporate it into the care plan and with a clinical team. Another key strategy is with supporting the tenets of the quadruple aim. And what that is a quality platform that addresses the outcomes and needs for not just the person with diabetes, but also the provider and the healthcare system, while providing health economics and cost savings and efficiency to the care plan. We also are very passionate about mental health and behavioral health. We all know that this can be a barrier to self-care and use of technology, and so identifying potential mental and behavioral problems, addressing them within our scope, or referring out is an essential part of a successful diabetes self-management plan and clinical management plan. And then finally, we strongly believe that people with diabetes and related cardiometabolic conditions have the right to high-quality diabetes care and education, and that a diabetes educator is an important part of their care team to ensure that all the parts and pieces of their health care are connected and that they are at the center. Health equity and diversity are major pillars in our ongoing strategic plan. We have multiple initiatives with that. Starting with diversity, we have a track at our AADE 19 in Houston this year that is on inclusive healthcare and inclusive diabetes care. We also are partnering with CMS or Medicare in their Health Equity Collaborative to ensure that people across America have access to diabetes and pre-diabetes care, education, and services. We work closely with the CDC, the Centers for Disease Control, so that we have the ability through generous grants to support programs in diverse areas that are socioeconomically depressed. We work within systems that have high levels of diabetes within their Hispanic populations, and we're even working with the Healthy Trucker Association to reduce the burden of diabetes in this population. That's a great question. Diabetes self-management education is designed for seven healthy behaviors to help for the best outcomes possible for people with diabetes. The platform is healthy nutrition, blood glucose monitoring, healthy exercise, problem solving, coping, and medication management. The person with diabetes has to juggle or manage all of these on a daily basis. And so our program identifies those that are the most imperative and important to them and give them the tools and the resources and the knowledge and the skills to do that. So that's diabetes self-management education, or sometimes referred to as DSME. The evidence is when DSME is provided by a qualified diabetes educator following the standards of care and curriculum, we see a reduction in A1C of up to 2%. We have clinical trials and systematic reviews that show that there are significant biometric improvements from people that participate in diabetes education, and it includes the reduction of A1C, but also the reduction in BMI, blood pressure, and cholesterol. And apart from that, there's an increase in appropriate utilization of healthcare resources, increased participation in primary care, and reduction of admissions and length of stay in hospitalizations. We have a very strong evidence, and we have no side effects. Education accomplishes much and should be a part of the patient's care plan, and this is where we need help. We need people with diabetes to see us to get the maximum benefit of their self-management at the time of diagnosis, annually, and when they have a change in their medication or in their treatment plan or lifestyle changes such as pregnancy. The more you see a diabetes educator or participate in DSME, the better the outcomes. We're dose dependent. We're not one and done, and sometimes people think that education is a one-time class. We provide so much more than education. We provide a holistic, patient-centered approach. I'm looking forward to a session that I'm chairing tomorrow, Innovative Diabetes Education in Diverse Populations. We have 8 presenters from Saudi Arabia, from Israel, from Mexico, from China, from rural America, discussing diabetes education in settings with incarcerated males, in farm communities, in pharmacies, discussing diabetes education for endo fellows in a scalable fashion across the country, and also with lipodystrophy. How does diabetes education impact injection technique and lipodystrophy? So there's a lot of exciting information that is going to come out of this session, and I encourage everyone to attend or to read.